Good afternoon. Thank you for joining us today. My name is Ruthie Marker from the Allergy Asthma Network. Welcome to our virtual lecture series by Unidos Hablemos, addressing the current disparities and barriers to care for the Hispanic and Latino community living with eczema. We have a few announcements before we begin today's program. First of all, participants will remain muted during the presentation. The session will be recorded and it'll be in Spanish. If you desire interpretation into English, just choose the globe symbol appearing on the previous screen and choose the English channel. We will be recording the presentation today and we will publish it on our website in a few days. The presentation will last an hour, including time for questions. We will address the questions at the end, but feel free to submit them at any time in the section of Q&A. The Q&A box is located at the bottom of your screen. If you have any questions or you need help during the presentation, use the chat. Someone will be there tending to the chat to help you out. We will respond all of the questions that we can before we finish today. Please know that we don't offer continuing education credits, but we will provide you with a certificate of attendance if you need it for your records. You will receive an email with supplementary information and a link to download your certificate of attendance in a couple of days. Today's presentation is titled Eczema and the Hispanic and Latino Culture. First, Bernice Aburto will share her experience living with eczema. After that, Dr. Fernandez Faith will be talking about eczema and how it's diagnosed and the different treatment options and some of the parameters for medical attention that affects Hispanic and Latino communities. We are especially grateful to Insight, who provide financial support to make this virtual conference possible. I would like to introduce Berenice Agurto. She will share her personal experience living with eczema. I would like to express my gratitude to Bernice for being here today, and I am giving her the floor. Hi to everyone. I am Bernice. I'm 34 years old. Currently, I live in the city of Mexico. I would like to tell you how my experience has been with my skin throughout my whole childhood since I can remember. I remember having very sensitive skin. I have the experience of being on a beach and having to walk out or leave because the skin of my feet was very hurt because of the sand, because of the salt. After that, I remember my mother going to dermatologists here in Mexico City to explain what was going on in my skin a little bit, why it was irritated, why every now and then I had itchiness, why it would get dark. During the course of that period of time in Mexico, at least here, we didn't really have real information or a diagnosis regarding what was going on. So it was treatment that would simply alleviate the symptoms. Nothing drastic, nothing serious. During my entire youth, I graduated as an attorney, thanks to creams that became part of my routine, especially blockers. I maintained a certain stability with my skin, but of course, always being very sensitive to certain cosmetic products or to certain aesthetic treatments, specifically waxing or anything that was very aggressive. I could not get involved in that, but up to that point, I didn't have any problems. After that, I moved to Huntington Beach, California, and that's when my lifestyle changed dramatically. I started to practice yoga. I changed my food, maybe the humidity, being close to the ocean, maybe that helped my skin out. And for the first time in my life, my skin was very flexible, shiny, and you could tell that it was healthy. But it's here in California that I meet the person that is now my husband, Greg, and we decided to move to Mexico, go back to Mexico, and we decided to be parents. So that's when the dramatic part starts with my eczema, because ever since the first or second trimester, my skin became very sensitive. In fact, the hair on my skin that would grow sometimes hurt. And I start to feel dryness in my breasts, my nipples, and this started as dryness, a little bit of itchiness. But, I don't want to be over dramatic, but they started to crack and a fluid started to come out, which was kind of yellowish. So I tried to use gauze, or if I wore clothing, it would become attached to the skin. And then when I would remove it, it would come off the wound, the scar that was healing. So I went to see dermatologists. They gave me very small doses of steroids. It was a cream steroid, and it was very small, very low because I was pregnant. I couldn't really use a high dosage steroid, but without giving me reasons, if it was perhaps due to hormones or reaction in my skin. I really didn't have a diagnosis. They just helped me heal the skin a little bit that was already very irritated. And that's how I spent my entire pregnancy. I did not have anything on the upper part of my body, because if I wore anything, it would make the situation worse. And until July 22nd of 2024, when our baby is born. And that's when everything became even more complicated, because I had decided to breastfeed exclusively. And thanks to the creams and lotions, my skin had improved a little bit and I was able to breastfeed for 1 month. But after the second month, it starts to crack again. It starts to become dry. I feel pain again. Again, there's fluid. So I can't be too close to the baby, because besides the pain, it's uncomfortable for both of us. So when the third month starts, the pediatrician says to me, it's not a good idea. The baby, the baby's weight is very low, and I just was not having a good time while breastfeeding, and it was also a very strong emotional subject for me. The baby is fine. She drinks formula. She recovered her weight. She's healthy. She's strong. So I went back to the topical treatment with steroids. That, yes, it's true. My appearance got better, but it hasn't healed 100%. I feel discomfort during some times of the month, or with certain textiles on my skin, on my body, but the appearance has improved. So thanks to the experience with my husband, he also had a very strong episode of eczema. We have learned how to understand health uh, in a very integral way. We are the result of what we see, what we eat, what we hear, the environment that we're in, and we've achieved helping our skin in different ways without necessarily depending on creams or clinical diagnoses that in Mexico it still doesn't exist. So I'm very grateful to you for your attention, and that's it from my part. Thank you so much, Bernice, for sharing your story with us. Thank you. Now I'm going to invite the doctor so he can speak to us about eczema, and I am giving him the floor. Thank you so much. Thank you for the invitation. It's a pleasure, it's an honor to be able to be with you, sharing and speaking about such an important issue like eczema. And I'm going to share some slides, especially eczema in our community, our Latino and Hispanic population. My name is Esteban Fernandez. I'm a dermatologist. I'm a pediatric dermatologist. I'm from Costa Rica. I work at the Pediatric Hospitals Nationwide Children's, Ohio. I would also like to thank Bernice for sharing her story. It's a very personal story, and I think it's a story that shows how eczema affects not only the person, but how it affects every person around you, the family, relatives, friends, coworkers. And it also shows how eczema is not only a medical problem, but it's a physical problem, but it's also a problem that can affect you emotionally, socially, and it's just very important. These are very important aspects that we have to take into account. So, Bernice, thank you so much for sharing your story. So, these are the topics that we're going to talk about in a few minutes. We're going to talk about what is eczema, atopic dermatitis, what is the difference between these terms, who is affected by eczema. There's very misinformation, myths, truths regarding eczema. So, we will talk about some of these subjects, and we're also going to take some time to speak about the treatment. What are the different parts of the treatment that we should consider? And something very important, how to communicate with the healthcare providers, with the doctors, the nurses, and all of the medical providers that are helping us control the eczema. So let's start with what is eczema? Eczema is an inflammatory skin disease. It's not an infection. It's something inflammatory. There's inflammation and it's taking place in the skin, and it's a chronic condition. Chronic means that it will last for a very long time. It's not something that comes and goes quickly and never comes back again. It's not like an ear infection or a viral infection that comes and goes. This is something that we'll be dealing with for a long time. It also means that it's not a condition that we have something that will heal it. We don't have medication or cream that we'll wear once and that's it. It's gone forever. This is a condition that we will try to control. And the objective is to keep it under control, knowing that we will not heal it 100%. But nevertheless, a lot of people will improve in a significant way as they undergo the treatment. We will see eczema. It starts in children, and a lot of them, as time goes by and they get older, eczema will improve in a significant way. But nevertheless, in some people like Bernice, you might have to continue dealing with eczema even during adulthood. And eczema is characterized by three symptoms. It's dry skin. The people that have eczema have very dry skin. It's very hard to maintain the moisture in the skin, and you'll see it's constantly dry. Another pot, pruritus. It's a medical term for itching, stinging, and every country uses a different term, but we call it itching in Costa Rica. And then we have inflammation of the skin. It's an eruption in the skin and it looks like redness of the skin, but it's not always redness. We will see different ways of eczema presenting itself in the skin. Sometimes these terms can cause confusion, eczema, atopic dermatitis. Many times we use these terms as synonyms, but really, eczema is the more general term. And there are different types of eczema. There are 7 different types of eczema, and atopic dermatitis is the most common type of eczema. And those are the different types. Not every person with eczema has atopical dermatitis, but they all have eczema. Another thing that's important to consider is that a person can have different types of skin. The persons with atopic dermatitis have very sensitive skin. So a person with atopic dermatitis might have contact dermatitis, dyshidrotic eczema, which is what we call dandruff, especially in our scalps. So it's very often that we see that these different eczemas are found in the same person at the same time or during different moments of their lives. In general, we use as a synonym eczema, atopic dermatitis. So from now on for this chat, when I say eczema, I'm also referring to dermatitis. Who is affected by eczema? Eczema is one of the inflammatory diseases. It's one of the most common ones. We have statistics from 2022 from a few years ago that show that there are 223 million people all over the world with eczema. So this is a very high number of people that suffer with eczema. As I mentioned before, in general, children are affected, young people, at least in the beginning. So, of every child, 20% of children, 1 out of 5 will have eczema. And then as they grow, it'll start going away. And then we can observe that 10% of adults, in other words, 1 out of 10 adults, will also suffer of eczema. Eczema can start at any age. It might start during childhood or further ahead in life, but nevertheless, most people start from their childhood. But a person can also start in their adulthood. Regarding the Hispanic population, approximately 8% of Hispanic children will suffer of eczema. So it's a very important number of Latino and Hispanic children, they will have eczema. And there are different studies that show that Hispanic children and African American children will suffer of more severe eczema, and it's more persistent. And we will talk later on about the severity and the persistence of the eczema, especially in Hispanic people. So now let's talk about some myths and truths. As I mentioned before, there is a lot of misinformation regarding eczema, so it's important to know which is the truth because not all myths are true. One of the myths, and that I hear the most, is that eczema is contagious. I'm asked if eczema is contagious. And of course, eczema is not contagious. If I touch a person with eczema, I'm not going to catch eczema. But it is true that there are people that have eczema, the barrier of the skin, because it's not intact, it's very frequent that they have infections, but this does not mean that the eczema itself is contagious. In other words, it is not contagious. And a lot of children, even adults, they suffer when they're in school or at work because the other kids think that it's contagious, but it is not contagious. Myth number 2 is that it's caused by a lack of hygiene. It has nothing to do with the lack of hygiene. A lot of kids suffer in school because they think that they have dirty skin or they don't take baths often, and that's why they have eczema. But this has nothing to do with hygiene. Of course, we have to maintain a very good hygiene, but lack of hygiene is not what causes eczema. So perhaps parents, care providers, provide information to the school. If they are seeing these problems occur, they should give the truth about eczema, that it's not contagious, it's not lack of hygiene, so that they have less problems. One of the questions that I get asked a lot is if eczema is caused by food allergy or if it's caused by other allergies. This is a little bit more complicated. Eczema or atopic dermatitis, as I mentioned before, can be associated to other allergies or atopic diseases, or people with eczema or atopic dermatitis are, are prone to have more allergies to food or asthma or environmental allergies, but it's not that this is causing eczema. For example, if a person is allergic to nuts and we remove the nuts completely from the diet, eczema will persist. It's not an allergy to the food what is causing the eczema. But despite this, we also see some existing allergies. Those might be one of the factors that cause the eczema to become exacerbated or get worse. We see this a lot during the seasonal changes. We have environmental allergies. During the spring, if these allergies are getting very active, we'll see eczema activate itself as well, but it's not directly caused by this. Another myth is that if there's no redness, there's no inflammation, and there's no eczema, it's not active. Truthfully, inflammation in the skin will appear in different ways. It depends a lot on the types of eczema and it depends on the type of skin that each person has. So I wanted to show you some examples of people with different types of skin and how you can observe the different appearance of eczema. You can see a person with light skin. You'll see the eczema looks a little pink or pinkish, and then that would be the picture on the left. But if the skin becomes darker, for example, our population, you see the redness won't be pink, but it'll be a red that's darker. And then if we have very dark skin, the inflammation won't even be seen as red, but we will see hyperpigmentation, more color in the skin. We will see brown or dark brown spots, and this means that eczema is very active. So we won't always see redness, and a lot of times we'll see darkness of the skin. These are other examples of people that have eczema. We don't see redness, but we see an increase in the pigmentation of the skin. And we also see that the skin becomes thicker. So it's not only active, the eczema is not active, but it's been active for a long time. It's an eczema that has not been kept under control, and the skin has become thick. And one of the problems with the darker skins is that sometimes the diagnosis is done very late when the eczema has been very active for a long time because the eczema is not recognized during the early stages, because a lot of health providers, a lot of doctors think that if they don't see redness, there's no eczema. And that's why a lot of times there's a late diagnosis and a late management. And in these patients, it might be different. These are one of the reasons. One of the problems is that there's less representation of patients with dark skin in the medical literature and during the investigation stage. So when we're studying medicine, the medical books or the medical magazines only show patients that are light skinned. So this has been changing, fortunately, and we're seeing more representation in different cultures, different ethnias, and different skin colors, skin tones. So we're hoping that this will improve regarding eczema and other diseases, inflammatory diseases. The other problem that we see is disparity in health. We'll talk about this further ahead. This is one of the other reasons that the eczema diagnosis is late and the management is late. So it takes more time to control the inflammation and for the patient to improve. Which are the disparities in health, especially in the Hispanic population? As I mentioned before, Hispanic patients have the tendency to have more severe eczema and they have more persistent eczema. And this is because the presentation, the appearance of eczema might be different. Perhaps you don't see the redness, you don't see the darkness. So then it's thought that there is no inflammation or it's diagnosed as something else. Another problem that we observe is that access to health services. There are different studies that show that patients from the Hispanic populations, it's more restricted for them to go to an emergency. They go more for an urgency or urgent care, and that's not the ideal thing. We always want to control the eczema with a pediatrician or the family care doctor, and patients avoiding going to emergency or an urgent care to take care of the eczema. Another important factor are the social economic factors. It's a high cost treatment. Not only the creams are expensive, but we also have to consider a special soap that has to be used, a special humidifying lotion, and it's a high cost treatment. And we have to consider that. It's very important. The other part is teaching, educating when it's regarding health, having the necessary information, having the knowledge, the necessary knowledge to have the best management of eczema. So, as patients or parents of children that have eczema, we have to at least have a base of knowledge to be able to manage the eczema in the best way possible, to communicate with the doctors, with the nurses that are trying to help us to be able to control the eczema. Another myth is that it only affects the skin, so you just have to wear cream, put a cream, and that's it. But as we've seen, Berenice's story shows very well that eczema is not only a problem in the skin, eczema is something that can appear in a more global way. As I mentioned before, eczema can be associated to other atopical diseases. These people might have more allergies, rhinitis, asthma, different problems. We know that eczema has a social, psychological, social impact. There are studies that show that eczema is associated to higher risks and incidence of attention deficit, anxiety, depression, and behavior problems. And eczema is something that will affect the daily life of a person's school performance, how the person will perform while they're working, family activities, sports activities, or social activities. So eczema is not only a skin problem, it's not only enough to, just wear a lotion and that's it, but it's important to know that eczema is something that will affect the patients in a very global way. Regarding the treatment for eczema, there are different treatments that we have to consider. If we do not treat or manage each one of these parts, we are not going to have the best treatment for eczema. One of the most important parts is treating the dryness, as we mentioned at the beginning. Eczema is characterized by very dry skin, so we have to try to maintain the moisture of the skin, and it's very important. We have to control the inflammation. Eczema is an inflammatory problem, so it has to be controlled. That helps us control the itchiness, the outbreaks, and these are one of the biggest problems in our patients. It's also important to detect and know which are the factors that cause the outbreaks. For example, weather has a lot to do with it. Bernice experienced it, especially in the United States. States that have a lot of seasonal changes or temperature changes, eczema has the tendency to become more active during the winter, during the fall, during the winter, and then during the spring, it improves. But for other patients, it's the total contrary. It activates more during the summer when they're sweating a lot, when it's hot. For other patients, it's all year. There's no difference. It can happen at any point in time during the year. Other factors that might initiate a reaction is, for example, if a child has a cold or uh, catches a virus, this will affect the immune system and this will cause the eczema to activate itself. And as we mentioned before, if a person has allergies, when they're experiencing the allergies, this might also make the eczema become exacerbated. And it's also very important to consider how eczema is affecting us daily so that we can manage it better. So, regarding the dryness, eczema is characterized by a problem of the skin barrier, the layer of skin. The skin might open up a little bit, and that's cutaneous. The skin barrier might not be moisturized. So, we need a moisturizer that can assure that we keep the skin moisturized. And I know it's very difficult. I always tell my patients, you put Vaseline on, which is very thick, and 10 minutes later, it's like you did nothing. But it's important to continue putting on these moisturizers because this will assure that the skin barrier will be as intact as possible. Regarding the moisturizers, the more simple they are, better it is. Less ingredients is better. It's important to use a moisturizer that is fragrance free. Sometimes they're not very cheap, they're expensive, but it's also very important to consider the formula. If the moisturizer is a lotion, it's a cream, what is the best formula? So what I wanted to show you here is that the water content is going to be more in a lotion, a little bit less in a cream, and much less in an ointment. So if there's less water, it will have more oil. So then in general, the ointments and the creams will be better to keep the skin moisturized and to avoid it being so dry. Sometimes when we put a lotion on or something that is in liquid form, especially when the skin is inflamed or irritated, it might burn and nobody will like that sensation. So in general, the ointments and the creams are much better for the eczema treatment, not only as a moisturizer, but also for the medications that will be used so that it doesn't cause this burning sensation. Very important. The other very often question is how often do you have to shower? In general, the baths should be frequent, short, less than 10 minutes. The water should not be too hot because the hot water will make the skin very dry, not cold either, but at least the water should be warm. And as I said, it's very important to wear the moisturizer, to put the moisturizer on. And we are recommending more frequent baths. And this is because when the skin becomes wet, the skin will be more moisturized. And then once we put the moisturizer on immediately after the shower, we are sealing the moisture in the skin. And other reasons is that during the day, if we have been exposed to an irritating agent or something that will make it worse, if we take frequent showers, then we will take that away. It's not that often to use soap, but maybe in the intimate areas, the private parts, but it's not necessary to use soap on the skin every day. But yes, exposure to water makes it better. But each patient will have a different experience. I see a lot of patients that experience the opposite. If they take very frequent showers, the skin becomes very dry. So it's important to treat your skin a better way and knowing what is the thing that will help you the most. To control the inflammation, this is when we use different medications, and the first line are topical medications, medications that are applied to the skin, lotions, moisturizers, etc. And then we have phototherapy. It's UV violet rays that we use to treat the inflammation, and we also have systemic medications. I think this is a time that we are very happy because there has been a large amount of studies regarding eczema. We have made a lot of progress regarding eczema and developing medications for eczema. So fortunately, we have a lot of medications that are much better and control eczema very well. Regarding the topical medications, we have topical lotions, and we have the topical corticosteroids. There's a lot of misinformation regarding this, and a lot of patients don't want to use the corticosteroids, but they come in different dosages, high ones, low ones. But what is very important is to pick the corticosteroid that is appropriate, the dosage appropriate for the right age and for the right part of the body. It's not that we're going to use any corticosteroid for any part. If it's the face, it's very different from if we're treating the foot. And if we're treating a baby, it's different from treating an adult. And this is where we pick the medication that will be in accordance or better for the patient. But we also have options that don't have corticosteroids and we use frequently. But in general, to improve or control the corticosteroids, have the tendency of controlling it in a faster way. But there's a series of medications that do not have corticosteroids, and we use frequently, especially when the eczema is better controlled. Or, like I said, we've been developing and we are going to see more and more medications that are available to improve the eczema and control the eczema in a better way. We also have systemic medications. In general, we divide them into groups, the traditional ones, and these have been medications that have been available for decades, and newer medications. These are the ones we call biological. So sometimes there are patients that need systemic medications, and the difference in these systemic medications is that a systemic medication will control the inflammation from inside. With the creams, they're trying to manage the inflammation from outside, but with a systemic medication, it starts from inside. We use a lot of traditional ones, but we're using the systemic ones more and more. And it's something that we've seen. We've seen a change, a total change, and it's very positive regarding the medications that are being used. And a lot of these are approved for children, additionally, even when they're 9 months old. Some of these are approved for adults only, but they control eczema very well. But of course, they all have different risks, different secondary side effects. So I think we are living through a moment that is very emotional regarding eczema because they are developing a lot of studies and they're investigating a lot, and we're making a lot of progress, not only regarding knowledge about eczema, but how to control it. Now, a lot of patients ask me, Doctor, how about a natural treatment? Do you have a natural cream, a natural lotion that we can be used? So it's important to understand and consider that just because the label says it's natural, it doesn't mean that it's the best thing to treat eczema, especially people that have very sensitive skin. Now, if you see this picture, you can see that this is a picture of poison ivy, that you see it here a lot in the United States. I never saw this in Costa Rica, but here in the United States, it's very popular. Poison ivy is natural, but who would put poison ivy on their skin? No one. This might irritate the skin. So just because it's natural, especially the label saying it's natural, it does not mean that this is the best option. What are the products that can improve eczema? Natural oils. They've become very popular to take care of the skin. And in fact, there are studies that have analyzed and investigated and seen which one have more benefits and which ones are better to avoid. So, natural oils might benefit the skin, especially eczema. We have sunflower oil and coconut oil, especially the natural one. There are many coconut oils right now, but it should be one that doesn't have a fragrance, that doesn't have a lot of preservatives. So we have to be careful. So it has to be natural coconut oil. And at the same time, there are some that it's better to avoid. Olive oil, for example, might cause more irritation because it can damage the skin barrier. And there are many people that have more infections, yeast, fungal infections, because they love olive oil. So some will help and some will be more damaging to the skin. And there's a very important thing that we have to consider, essential oils. They've become very, very popular. Everybody has essential oils, but it's important to understand that there are some essential oils that these are concentrated fragrances, and there's a big variability of ingredients. They're not regulated by the FDA. So it's not a good idea. And we won't know what these essential oils contain. So patients that have eczema or dermatitis or are very sensitive to skin, they have a very high risk of contact dermatitis. If this concentrated fragrance goes on the skin, it will irritate the skin or exacerbate the outbreak. So we have to be careful. Whenever we're going to use a medication or a new product, it's important to try it out first, test it on one part of the skin that is not irritated or has inflammation to make sure that it won't cause that. Another natural treatment is using oats, especially colloidal oatmeal. It shows that it improves the skin microbiome. It repairs the skin barrier. We all have natural bacteria in our skin. It will improve the microbiome. It'll repair the skin barrier. So a lot of times I tell the patients to take oat baths because this will bring a high benefit and it will relieve the skin. It won't bleed and it won't itch. So this can help them out. A very important part of when we treat eczema is communication. It's the communication with the healthcare providers, with the doctors, the nurses, and with every person that is trying to help us control the eczema. Because to control the eczema, it's teamwork and it requires a lot of work. Sometimes we think it's easier to treat high blood pressure. Oh, I take a pill and that's it. But to treat eczema, we have to think about what soap, what moisturizer, how many times a day, how many baths should I take? How many times should I put the moisturizer on my skin? I need one for my face, one for my foot. So it is a lot of work. And that's why it's very important to conduct teamwork, the patient, the family, the doctors, the nurses, so that we can keep the eczema under control in a positive way. So when we're talking to the doctors and the different healthcare providers, it's important to communicate how eczema is affecting us. Not only what are the symptoms of the skin, if there's a rash, itching, if we're having sleeping problems, if we're having school performance problems, social activities, not sleeping well at work. If we're not sleeping well, we won't perform well at work. And then social activities, sports, these are all factors that we must communicate because we consider all of this when we decide and create a plan to treat the eczema. We have to know what routine we have to manage the eczema. It's important to say if we're using natural products, home remedies, sometimes it might make it worse. It's also important to know what type of product is preferred, an ointment, a cream, etc. What formula do we prefer? And if there's a question regarding the medications, if there are side effects, if there are specific care that we have to provide. And I think it's very, very important to have a very good communication and know what the mental health effect will be, not only the patient, but also with the family, because you can imagine that if a child has eczema and the child is not sleeping well, who's going to sleep well? No one's going to sleep well. The parents don't sleep well. The siblings won't sleep well. So it affects everyone in this core, this family core. So that's why it's very important always to communicate and know what the mental health effect is on everyone. It's also important to prepare for a medical appointment. What do we have to consider? We have to make a list of medications that we're using. These are all complicated names, so it's very important. The patient sometimes says, well, I'm using this cream that has a stripe. It has a red stripe and orange. Well, they all have red and orange stripes. So it's difficult to know exactly what cream they're using. A lot of patients will bring a bag with the medications inside. That's perfect. It's very good. Maybe not practical, but take pictures. Everybody has a cell phone. You can take pictures of the medications that are being used, know where on the body these are being used, the frequency of use. Sometimes a patient will come to the appointment and the eczema is doing great. The skin looks beautiful, but maybe a month ago it looked terrible. So sometimes we won't see that in the patient when they come in. So it's important to take pictures of the exacerbation of the eczema so we have a better idea of what the eczema looks like when it has erupted and when it's exacerbated. Also, always bring a list of questions and doubts because when there's an appointment, there's a lot of information that we're providing. Sometimes we forget about our questions that maybe we thought we were going to ask. So it's always important to write it down and always request a written management plan and continue this plan the best way possible that we can. I wanted to mention a couple of things regarding the social media because it can help a lot. You can obtain very good information. You can learn important information, but also social media sometimes can be detrimental. Sometimes the information, there are many influencers regarding skincare. So we have to know that a lot of them have a financial interest when they're recommending certain products. And these are not going to be the best products for us, especially people that have sensitive skin, especially people that have eczema. We have to be very careful in the messages that we're receiving, the information that we're receiving. We have to have critical thoughts and know if it's something that will be beneficial for us or not, and know where the information is coming. So it's important to always find resources that we know that the information will be good information. For example, Allergy Asthma Network, National Eczema Association, American Academy of Dermatology. These are all places that we will have the best information that can help us control the eczema in the best way that we can. So this is what I wanted to share with everyone. And now we're going to open the floor for questions. Yes, thank you very much, Dr. Fernandez. Thank you so much for the presentation. It's very informative, and I know that we've all learned something today. We will take questions before we finish today. The first one is for Bernice. How has having eczema affected your self-esteem and your confidence, your self-confidence? Very good question. Thank you for asking that question. As the doctor said, eczema implies much more than the physical subject regarding the skin. When I had my worst outbreak, and this was during my pregnancy and during the lactation period, I was very depressed. And it went beyond the subject of pain. And this was because the skin, the organ that is in contact with everything, with the air, with wind, with the clothing. So beyond the pain, it's the discomfort of not standing up appropriately, not feeling safe, not having the confidence, not feeling sure of myself. And then, of course, the intimate subject, with my partner, because I don't want to be touched, it hurts because the appearance is not a pretty one, because the appearance it looks really bad. So at one point, I don't know if you ever saw this movie, The Substance, that it's something very strange. It has no shape. It's like I had that sensation of my nipples, they're cracked and liquid is coming out and it hurts. And just seeing it hurts. So it affected me a lot, especially during the lactation period. It was emotional pain because I felt guilty. I felt guilty for my baby because my baby's weight was low. And I felt that I wanted to give the best milk to my child. But doesn't matter how much I tried, my skin could not because of the constant suction and the rubbing. So when I found out that the baby had a very low weight, that was even more painful to me. And it was emotional pain because I thought that I was affecting my baby with this condition. And of course, it was not in my hands. And that's all. Thank you so much, Bernice. Now, a question for Dr. Fernandez. The question is related to dermatitis and I'm sorry, related to contact dermatitis and celiac disease. Is there a relationship? Because this question is coming from someone that this person in the 40s, it's stronger, it's more intense. Excellent question. Celiac disease has an outbreak of the skin and eruption that looks like eczema. It itches a lot and it appears as little blisters or little vessels, especially on the elbows, the knees, the back. And sometimes this might be confused with eczema. So, celiac disease, they might have this outbreak, which is called dermatitis in the form of herpes. It's not atopical dermatitis, it's a different type of inflammation. So that's on one side. It's different from atopical dermatitis, and some studies have been conducted. And it's something that we're still learning. And we're trying to see if there's perhaps a change in diet or food that might exacerbate eczema. And of course, gluten is very in style, especially regarding the disease, if it affects it or not. In general, gluten allergy or being sensitive to gluten is not as associated to this, but of course, everybody has a very personal and unique experience. So it is important to try to have an idea certain foods that exacerbate it or not. So in general, we do not recommend a gluten-free diet, for example, with atopical dermatitis. Most people that have atopic dermatitis do not have sensibility to gluten, but of course, every person is different and unique. Thank you so much. One more question for Bernice regarding medical appointments. How were you your own advocate, regarding questions that you asked and the treatment that was given to you? Well, with that question, I think you're going to make me cry because the experience was very hard, very tough with the doctors. I think there's also an issue regarding lack of humanization with the patients. And it's not that we're not only a symptom, we're not an irritation. We are human beings. We're human beings with emotions, and we have an emotional state. And I'm saying it specifically, for example, in pregnancy, there were things that were even on the border of violence. There's not a back and forth of information. It's the doctor tells you when, where, how. And if you ask a question, it's like something that doesn't concern you. It's like you don't have the ability to be able to provide your opinion. And it's something that I mentioned at the end of my testimony that thanks to me having a great team with my husband, we understood that health is integral. That yes, it is true, they will give you a cream that will help you out with the symptoms. That's not going to heal everything that's implied with eczema. Like I said before, emotional, depression, lack of confidence. These are topics that honestly, I think with one or two doctors, I was able to treat them and talk and say, listen, I don't feel comfortable with this treatment. I would like to see something else. Additionally, I remember the experience with a dermatologist that was horrible, that assured that our baby was going to have the worst case possible of eczemas because I had eczema, my husband had eczema. So he felt that he had the freedom of joking around and saying, oh, the baby is already sentenced to having the worst case of eczema during her life. And I wasn't really confronting him, but I did feel secure enough to say, wait, how do you know if you're not sure about it being eczema? How can you sentence a baby to say that they'll have the worst case of eczema only because the parents have it? And I made the observation. I said, my baby is perfectly healthy from the first day, and that's how it will continue. But this type of interaction with the doctors that it seems to be we're part of a statistic and not an individual person, living with eczema. So that was my experience with the doctors. And I feel so much pleasure knowing that we have these panels that we can talk and chat about all of this information regarding eczema. It's always very important to try to do this job as a team. One person cannot resolve it. So, as I said, it's teamwork. It's from the patient, it's the core of the family, the doctors, and it's always teamwork and having that communication and the understanding of where we're living, what our experiences were, even with other doctors or different medications, to know how we can direct ourselves and know what the next step will be to improve the eczema. I think it's very important for the patient to feel comfortable with the doctor, the medical provider, and to feel the confidence to ask questions or to even question the decisions and say, doctor, why are you giving me this medication if I already used this medication or I have this other problem? So I think that's very important. I know that we're not always open to that type of relationship with the patients, and it's not always easy to find a doctor that will help us in that sense, but always try to find a person that can listen to us and that can truly understand how eczema is affecting us in a very global way. It's not only a medical problem, not a physical problem. It's something that will affect us in many different ways. Thank you so much. Unfortunately, we have no more time, but thank you. I just wanted to thank both of you for being with us. Thank you. Thank you. Thank you to everyone. Our next conference will be April 24th at 4 p.m. and it's about chronic urticaria, and this is in the Latino and Hispanic community. And with this, once again, I would like to thank everyone for coming to the presentation today. Especially thank you to Dr. Fernandez, Bernice for the presentations. I hope everybody learned something new today. In a couple of days, you will receive an email with a link to the recording and evaluation and additional resources regarding eczema. So please make sure to complete the evaluation regarding today's presentation. Thank you again from all of us at the Allergy and Asthma Network. Join us in our daily efforts to help us breathe better together. Thank you so much.